In this video, I'm going to show you a little bit about calculating INOs. INOs is the um, acronym for intake and output. So we have here what exactly is intake and what exactly is output. Intake would include liquids taken by mouth, IV fluids, and then the feedings that you put down an NG tube or a PEG tube. Sometimes it will include jello. There is a standard that anything that becomes liquid at room temperature is to be counted as intake, but then, Jello does not fall into that category because it does not become liquid at room temperature. However, ice cream does become liquid at room temperature, and oftentimes we don't use ice cream as a part of the intake. But I don't know how your clinical instructor is going to want to handle this issue, but whatever you do, just go ahead and do it the way your clinical instructor wants you to do it. Other than that, it's liquids, PO by mouth, IV fluids, and then those feedings that you put in a nasogastric or a PEG tube. As far as output is concerned, we have urine, of course, and we have liquid feces. As far as bowel movements, you might not count that as output. You might just sort of describe the bowel movement, large or whatever, color, whatever, and just make a note of it. But the liquid part would probably be counted as um, output. Blood and drainage from wounds. Some of the drainage devices, the wound devices, have like a little bulb where you can actually drain out the um, liquid from a little bulb and then measure it. Other ones don't, and like if it was some kind of dressing, you would have to just use weight to um, to figure out how many milliliters. I'm going to show you how to do that. So we have here 1 liter of water weighs 1 kilogram. Oftentimes, patients will wear adult briefs or chucks. This is a chucks, CHUX, chucks. And so um, they go ahead and use these to help to measure the output when output is being measured. What you do is you take a dry one and you put it on the scale, and then you put the scale at 0, and then you put the wet one on the scale, and the difference is the weight, how many grams, and then you know how many milliliters. So for example, like I said, 1 liter of water weighs 1 kilogram, so that is right here. 1,000 milliliters is 1,000 grams, so 1 milliliter is 1 gram. So that's the standard that you want to use as far as weighing things. This is an example of a form that you might use for intake and output. There's various ones. You might be using an electronic medical record for this. Converting ounces to milliliters, 1 ounce is 30 milliliters, so a 4-ounce drink, you would just multiply the 4 ounces times 30, get 120 milliliters. Now that's not exact. I think if you go online, you're going to find, oh, Hazel, that's not exact. It's a little bit off. Well, this is PO. Generally, ounces, you wouldn't use ounces for output. You would just use ounces for intake. And so it doesn't have to be absolutely precisely exact. Output would probably need to be more exact. And if you were doing IV fluids or something of that nature, it would already be in milliliters. So then again, you would have to be exact. But as far as by mouth liquids, ounces to milliliters, we're going to use 30. And I can also tell you that generally a can of something is 8 ounces. So that would be 240 milliliters. It might say on the can a little bit off from that, but it's just easy to use the 30 milliliters to 1 ounce. 1 tablespoon is 15 milliliters. A teaspoon is 5. So 3 teaspoons is 1 tablespoon. And you generally wouldn't use this for anything except for example, giving some kind of cough medicine or some kind of um, liquid medication to a child, and that would be probably in the home environment, not in the hospital. In the hospital, you would have the option to draw it up in a syringe and be more exact as far as your milliliters. But at home, they use spoons. So we use teaspoons and tablespoons, and it works just fine. Okay, so you're giving your 2 teaspoons of cough medicine to your pediatric patient. How many milliliters? And of course, as you can see, a teaspoon is 5, 2 teaspoons would be 10. Easy calculation. So here we go. At your facility, coffee is served in 12-ounce cups. Nice, good, big cup of coffee. And juice is in 8-ounce cups. Your patient had 2 servings of coffee and 1 of juice. In addition, when she took her by-mouth medications, she had 2 tablespoons of water to swallow it down. So how much would the intake be? So we have 12 ounces, that equals 360 milliliters because you multiply each ounce by 30. And then that's multiplied by 2, 720 milliliters. 8 ounces is 240 milliliters, as we already discovered, and 2 tablespoons are 30 milliliters. And so here we have it, 720 plus 240 plus 30, 990 milliliters. That would be the intake for these items. Okay, so your patient had 30 milliliters of urine and 45 milliliters of drainage from his Jackson Pratt tube. He also soiled the bed with diarrhea. Your clean adult brief weighs 300 grams, and your patient's soiled adult brief weighs 520 grams. What was the output in milliliters? So here again, you take your 330 plus your 445, and then if you take the 520 grams and you subtract the 300 grams of the dry adult brief, you come out with 220 grams, which is 220 milliliters, and you get a total of 565 milliliters for output for these items. So I'm hoping that this helps you and you can do some of the problems in the book, any book that you decided to purchase, and I'll put some problems up also on the site. Okay.